Thank you all. We're here to talk to Dr. Sarah Present, who is the Clackamas County Public Health Officer, Kim Taves, who's the Director of Multnomah County's Communicable Disease Program, and Trisha Morgantown, the Washington County Public Health Manager. So what we're going to do is hear some brief remarks from each of them, and then we will open it up for your questions on the a partnership with the health systems between the metro counties to ensure Phase 1A workers have access to the COVID-19 vaccine. So with that, I will ask Kim Taves to go ahead and take it away.
Good morning, everyone. Kim Taves with Multnomah County. I'm the Communicable Disease Director for Public Health in our county. Good to have you with us. As has been true for the whole last year of COVID response, information is changing really quickly. So I want to acknowledge that while we all planned this press conference and had a sense of what we were doing, I am aware that the federal administration may be changing some of their policies as we speak at the moment in terms of the order of people that they want to have vaccinated in the United States public. And we will await to hear from our governor how that transfers into our state of Oregon approach to doing things. So I'm going to give you the information today that we had planned on, and we're going to be carrying forward with this plan right now. But it may be as soon as this evening or tomorrow or sometime later this week that either we have a pivot in approach or we have a broader inclusion and opening of approach to more folks in our community getting vaccine. And at that point, then the folks who are involved in this regional collaboration that I'm going to share about with you today, we'll regroup on that and we will take that in stride and we'll get back to you with the new plan. So what I want to do right now is just speak for a moment to what's been happening so far in the last month with our vaccine. And I want to acknowledge that we've just passed the 1-year anniversary of the first cases being identified in Wuhan, China. And we have all been at this for a long time, relatively newer to the vaccine component of it, vaccine having arrived in our state just really in the last few weeks. So the two different groups that have been focusing on vaccinating so far. We have a state and federal partnership with retail pharmacists who are working under a specific contract to be able to bring vaccine to skilled nursing facilities and memory care facilities to vaccinate residents that are at highest risk as well as staff. And then separate from that, we've had our hospital systems. In our region, they have focused on vaccinating hospital employees in the inpatient settings and affiliated providers. And just in the last 7 to 10 days, we've seen an expansion where the county health departments have gotten some vaccine and started to either stand up vaccination for small groups of people and or give that vaccine to other partners who can administer it. And a small handful of what we call our federally qualified health centers have received vaccine. Those are our safety net clinic providers for Medicaid populations for uninsured folks and have gotten a small amount of vaccine as well. In the last week, the hospitals have opened up their vaccination to start to vaccinate some of the other colleagues that are in this group that we're all collectively calling Phase 1A. And Phase 1A not only means those skilled nursing facilities I mentioned, but also primarily healthcare worker staff in outpatient and hospital settings. But there's also some other folks that are included, folks who are working in corrections, some of the other residential facilities staff, as well as some folks who are either medically fragile or vulnerable and or their care providers who work in home with them. It's a whole lot of people in that Phase 1A to try to figure out what are the right pathways and approaches. And so what we've done in the last few days is we've tried to come together regionally and get a little bit more orderly and cohesive about how we are all going to move through together to vaccinate the other folks in this Phase 1A list who haven't been reached so far. And the goal that we've had is to really use that very strong infrastructure that our hospital partners have stood up to vaccinate thousands of employees so far, and to go ahead and open it up to other folks in the Phase 1A category, but to lean on the strength of our health departments regionally. And when I say region, I mean Clackamas, Washington, Columbia, and Multnomah counties, as well as to our partners, our CCO partners, Health Share of Oregon and CareOregon, that we collectively would take the role of reaching out to all of the different folks in Phase 1A, assuring them that there is a process. we've created a survey. It's a very brief web form that we have in the press release that's gone out so that everyone can link to it and can give us the information that we know. We'll do a real brief eligibility check to make sure that people are in the phase 1A who've signed up in that survey. And then we're working very closely with the hospital systems to identify week by week how much capacity do each of those hospital systems have. And we're in a sort of an orderly way working through that list of folks who signed up on the survey and linking them with hospital systems. At that point, each of those hospital systems will have some of their vaccination team reach out to the points of contact, to those healthcare practices or those organizations, and link with them to figure out where, when, and how will be their point of entrance into one of the multiple sites in our region where hospitals have stood up large-scale vaccination services. And then the point of contact will be the one to communicate with those employees, or it may be those families that I mentioned that have medically fragile folks in their household and have service providers in and out. And the point of contact will be in charge of communicating out with a set of folks who are actually going to get vaccinated to assure that they've got a easy, low barrier way to sign up for an appointment and to understand where they're going, when they're going. I do want to reassure everyone right now, because some folks are not sure that they want the vaccine yet, and other folks have decided that right now they don't want the vaccine. I will just say, as I say in every communication I have, vaccination is voluntary. It's not mandatory, whether you're an employee, a community member. And so this is something people get to choose to opt into. A lot of folks have been very excited to opt into it, and they've needed a pathway. So the great thing about our regional collaboration is I think we've made a more inclusive, open, transparent pathway that we've stood up over the last few days to go ahead and help make sure that folks in phase 1A are covered. And like I said, the news may be changing. The separate section of phase 1B we thought we would do. We have got a statewide community advisory board that's working to give recommendations, maybe superseded by some changes in federal policy, we'll see. But right now, we'll go ahead and keep moving forward with the process that we've pulled together recently. So with that, I think I'm turning it over to our next speaker to share a little bit more information from some other perspectives.
Thank you, Kim. This is Trisha Morgantown, Washington County Public Health Division Manager. So we're very appreciative of the support of our healthcare system and our hospitals to improve access to vaccine for the priority groups here in the metro region. The vaccine plan is very complicated, as Kim has mentioned. There are numbers of different individuals and groups that we need to prioritize based on the Oregon state recommendations. And this is happening in the midst of the highest rates of COVID disease we still have in the metro region. So we're pulling out all the resources that we can from the public health system and the healthcare system to get vaccine into the community and into priority groups. And we will change and move with the changes that may happen at the federal or state plan. We also need to remind the community that it's going to take several months to get through priority populations before vaccine is readily available to all community members. We truly appreciate the interest, energy, and everyone considering whether they will be taking a vaccine, but really it will take us until the summer to have vaccine available for the whole community. So Dr. Present, I will turn it over to you.
Thank you. I'm Dr. Sarah Present. I'm the Public Health Officer for Clackamas County, and I'm also a primary care provider in our Clackamas County Health Centers. I just want to take a moment to really acknowledge the patients and acknowledge my appreciation of our healthcare workers in the region, as well as others who are in phase 1A high priority groups. I'm grateful for our partnerships across the region with public health and with our hospital systems that we can move forward with getting more vaccine out more in a more organized way and in a more rapid way as a huge step in the right direction towards getting control over the pandemic. I'm happy to answer any questions around the medical aspects of the vaccination, but want to focus on the operational plans that we have here today. So thank you.
Thanks. This is Julie. I would ask our presenters to all get on video so everyone can see you. And then I would ask individual reporters, you are welcome to unmute yourselves and go ahead and ask your question.
Alicia Leslie with K2 News here. I have a question. You indicated and talked about this a little bit, but talking about how the U.S. Surgeon General said he wants vaccines to be administered to people 65 plus who might have a condition that makes them more at risk of the virus. Can you tell me exactly how quickly can local public health make the vaccines available to this group?
I can give that one a try. Local public health doesn't have a super deep bench depth for actually having vaccine administrators in our staff, nurses and others. We're really working in partnership with the healthcare providers, especially the larger hospital systems, to do the actual heavy lifting of, as they say, putting shots into arms. Our job is to help identify using an equity plan for sure, knowing that not all of the members of our community are equal risk, a prioritization strategy, and to really be communicators to all sorts of different segments of our community so that whether they speak English, they don't speak English, they are affiliated with community organizations or healthcare or they're not, they can all have access to the same information. And that we'll all try together to cohesively make sure that you all get some consistent messaging out from all of us about how to do that. I think that as we have been working on vaccinating healthcare employees, everyone's had the eye on the next phase with a great bit of excitement that as long as we can move quickly through this phase and we can open up the opportunity to the next phase, any learnings that we have from trying to do large scale vaccine right now in a COVID environment where we have to also stay physically distanced while we do the vaccination is what we build on then to open it up to other community members, whether it's by folks who have certain health conditions and or their age. It'll just be all the learnings we've had from the last 4 weeks of really hard work will be scaled up then so that we can even more quickly and more effectively reach large groups of folks. I know that the hospital systems have been working very hard to figure out how they can operationally do that. They're looking at a variety of sites in our region that may be outside of their own clinical campuses that might be better. They've been looking at some drive-through models, being aware of some of the safety considerations of allergic reactions that we want to be thoughtful of. So I think it's going to take all of us together in a really coordinated way to do that. But all the plans and the work so far have all been towards the eye that this isn't the end goal. This is just the step of vaccinating the workers so that we can then vaccinate the community members at highest risk. I think we've all been learning really quickly, actually. So I'm pretty excited about that.
Just follow up to that if I could. If the governor goes ahead and says vaccinate people 65 plus that fall into this group, how quickly could you vaccinate those people if they wanted one?
I think I can't answer that question. Go ahead, Trisha. You can take a stab at answering that question.
I was just going to support you, Kim. I think that the answer is truly that we really need our healthcare to support our healthcare partners in putting together those large events. And so that's our priority if we need to add additional people to the mix. So we're looking at not only what is the healthcare system able to do right now with their clinical approach, but what can we do in large scale atmospheres if indeed we're adding additional folks to the priority list at this moment.
I do want to add one thing. One of the supports that we can give to our healthcare system partners is staffing at some point. So if there are individuals who are interested in being vaccinators and want to sign up through CareOregon for the Medical Reserve Corps, we will likely be drawing on that pool of people who can potentially help give the vaccines. So we encourage everyone who's eligible to do that.
I am wondering, this is Amelia with OPB. There's a question in the survey about legacy and or about Kaiser and Providence and insurers. And I'm wondering, why does it matter who people's insurers are, given that everybody in the country is supposed to be getting the vaccine, free of charge?
That's a great question. Right now, we have built the survey for the models that each of the hospital systems have, and they're all at slightly different places and slightly different approaches to how to vaccinate their own members or their own patients who are people who are in that phase 1A eligibility. So Kaiser has a model or a pathway right now where people who are Kaiser members who are phase 1A eligible can go ahead right into the Kaiser system and schedule a vaccine for themselves. I think Providence is moving towards that and is quite close to it. The question for Kaiser and Providence right now is that each of those entities have agreed that if the majority of employees in one organization or one business are Kaiser members or are Providence members, because that's the employee insurance plan that they have, that they would be willing to take a handful of non-members as well. Sometimes employees don't have their employer insurance plan. Maybe they're on their spouse's coverage, for example. So they've tried to be sort of a little bit more like loose and flexible with how they would define who they'll take into their setting right now to be more convenient for a business or an organization that's got, 95% of their folks are on one plan, but maybe a handful of folks aren't, so that everyone could go to one place together. There is also the model that all the hospitals are working really quickly on to either individually or together collectively stand up the larger throughput, more community-based approach. And that has been happening already over the last week for a number of different employee groups, regardless of who their own personal health insurance coverage is. It's sort of a both and right now, your own patient pathway, as well as those larger, more open group settings. And I think that as the hospitals are ramping up into those more larger settings, I think the intention for all of us is probably so that we can be very efficient to move more fully towards those larger settings and not sorting people out. But right now we're trying to move folks towards any part of the system that does have capacity through the pathways they do have right now. And I think probably a week from now, 2 weeks from now, even regardless of what might be changing federally in terms of eligibility, there'll be a bit of a shift in the model to increase its efficiency. And at that point, it may become a little bit less relevant.
Hi, this is Lisa from COIN. Just a couple of questions. First of all, how many doses are on hand in each of your counties as of today that have not been given out? And I have a follow-up question after that.
So I can speak for Washington County. To date, we've only received about 1,900 doses and they're all spoken for. So they really, our focus in the first round was our EMS law enforcement focus. And so we really worked with our partners to provide vaccine to them. And right now we are working to ensure our federally qualified health centers as well are fully vaccinated.
And go ahead, Kim.
In Multnomah County, as of yesterday, we had 4,000 doses. A number of those, as for Washington County, we had transferred immediately over to EMS, and a number of those we also have used to vaccinate our own staff. The rest are either in our own property or we've transferred them over to a couple different occupational health groups, and with the expectation that we would be using up that vaccine within the next 7 days or so for our employees and for those key partners. Today, we just received another 2,200 doses of the Moderna vaccine. And we, as our hospital system has changed over the last few days, we need to go back to our lists of priority groups and sort of realign where that next 2,200 doses need to be used. So we haven't quite made a commitment to that yet, but that would probably be next week into the following week that we would use those.
A big question we're hearing from the public is, why not have mass vaccination set up now instead of surveys and you can go, but you can't go and you're in that group? Why not, like what we're seeing with the National Guard finally being mobilized in Oregon, why not just have that widespread and get it done?
I think that's something under consideration and discussion right now. And we don't have any news for you at the moment about that pathway.
But we've had 10 months to plan.
So the counties are following the Oregon state plan. So this was the guidance rolled out by OHA, and really we do not have authority to go outside of that guidance at this point. So we really are standing up what we've been asked to do in terms of the priority groups.
I got some questions here from Carmen Montes at Univision. Will employees have to show credentials when they go get vaccinated? And a couple follow-ups.
No, the employees will be routed into the pathways of whichever hospital they get assigned to by their employer. And so the assumption is made that by the local health departments connecting with the employer and getting them on that list, that we've already vetted that they're eligible. They will be asked to personally attest, which just means like verbally affirming, yes, I'm a member of that eligible group. But we're trying to make this a really low barrier pathway for people where we're not trying to be super stringent gatekeepers. I think that the pathways we've set up will sort of naturally link people based on what type of employment they have into the system for right now.
Two eligibility questions on that are cleaning staff from clinics also eligible in this new effort? And how about family members of practitioners?
Any staff who are either at risk of direct exposure to people with COVID in those settings or at risk of exposure to infectious materials are covered. So that's the answer for the cleaning staff. Family members of healthcare providers right now are not included in the governor's phase 1A plan.
This is Rachel Monahan from Willamette Week, a follow-up of sorts to that. Can you go over who is eligible in 1A? Is it all healthcare providers or healthcare providers who are seeing people directly and have a risk of exposure? Or can you help with your understanding of that? And then my other question is not a follow-up, it's what data have you gotten from the healthcare systems about how many people are taking the vaccine versus turning it down at this time?
I'll read you the language. This comes from the state website. This is the information that is on the Oregon Health Authority page coming from the governor. It says all paid and unpaid healthcare providers who have the potential for direct or indirect exposure to residents or infectious materials. That's the general language they're using. So for example, in our own county, we are trying to get vaccinated first, the people who are not just teleworking right now, not just doing telemedicine, but the people who are actually in clinic with face-to-face contact. Ultimately, some of the policies may change and we may be able to open up more types of face-to-face service provision again, if our healthcare groups are vaccinated. So I think it's up to each employer to read through that language and decide how they're going to interpret that language about vaccinating their team.
So you're not.
First priority is for folks who currently have face-to-face involvement with clients or with other folks who could be at risk for infection. But we're going to leave that up to each employer to sort of parse the words there on the list. And we're not going to try to move through things with too fine tooth of a comb for every organization or every practice. That would slow us down too much at this point. And really the goal is the efficiency so that we can all move as quickly as possible into vaccinating the community members at risk.
I think the second question is that the data continues to evolve in terms of what we're seeing of people that want to get the vaccine now, that want to wait and decide later. So we continue to watch that, but I think that it is changing as we speak.
Hi, it's Kristen Severance with KGW. My question is for Trisha Morgantown. Trisha, you had said that it would be summer until other people can expect to be vaccinated. Is that just for your county, or you're saying in Oregon? That's when, because we're getting a ton of questions about, timelines.
Yeah, in general, we're still uncertain of timelines, but we're asking people to consider that it's going to take many months. Certainly, when we listen to our national partners, we don't expect to have full community immunity until fall, so that because we need time to get through first the priority groups and then to the general population. So we're anticipating spring and summer is really when we're at the community level across the whole state, and particularly in the metro region.
Just a follow-up question, do you believe we should stick with this 1A approach, or do you think we should broaden it out and just get as many people vaccinated as possible who want it? The
reason to use the phased approach was really in terms of the severity or the opportunity to contract COVID. So I think that we're using the science approach here in Oregon in terms of getting people in different phases for vaccines versus just opening to all community members. And Dr. Present may want to talk a little bit more about that in detail.
Yeah, thank you. I think the phased approach really is focused on ensuring that we have adequate health care services and adequate coverage for those who are at highest risk of severe complications from the disease. Our overall goal in this pandemic is to decrease the morbidity and the mortality, so the number of people who die and the number of people who have severe disease. So focusing on those higher risk groups and those who provide healthcare for them is really going to help make the quickest move back towards some normalcy in our life and some lifting of restrictions and getting back to normal if we have those who are most at risk covered and protected from the severe disease.
This is Drew Reeves with KPTV. We've been hearing from a lot of people who are in this 1A group, but don't work for, like, say, a larger hospital, that they have been calling daily trying to figure out how they can get the vaccine. Their providers don't know. They've been calling hospitals. Hospitals don't know where they can go and get it. Why has it been so hard to get people in this 1A group this vaccine if they've been trying for so long? And why wasn't there a plan in place earlier to try and locate these smaller clinics to get these people vaccinated?
The survey, the link that we have right now is a huge step forward towards making this better organized and making sure that people have access. It has taken complicated partnerships with Oregon Health Authority and with our hospital system, as well as other healthcare systems. I do acknowledge that other places in Oregon may have had a more streamlined approach earlier on, and just acknowledge the fact that we have nearly half of the population of Oregon in the Portland metro region, and it's a much more complicated distribution plan and more complicated in our in rolling out the plan. So I am happy that we have this system now in place, and those independent providers can go to our website and fill out the survey, and we will get you assigned as soon as possible.
It's Amy Green at the Oregonian. I have some questions about who's going to be giving out these vaccines. My understanding is it's entirely going to fall on the hospital systems to give out these vaccines in this approach you're talking about. How practical is it that some of these hospital systems are going to be giving out the vaccines anytime soon, given that some of them are really struggling? Kaiser and Legacy, when I checked last week, had used less than a third of their vaccines. So are Kaiser and Legacy not on the list anytime soon to take part in this program? Which hospital systems have said they can start doing this, and how soon?
So part of our new, thank you, Kim. A big part of our new approach is having more frequent conversations with the hospital systems about their capacity. The hospital systems will be providing the majority of the vaccine, and we in local public health will be ensuring that any gaps are met. And there are some other options for people to get vaccinated that will ensure people get connected to if it's not appropriate for the hospital systems. But they are working very quickly and moving as much vaccine as they can, and this is a good step forward towards moving more. Like I said before, one of the concerns is around staffing, and we are working on plans to help ensure that we can have volunteer staff or public health staff or various other people to help ensure that the sites are staffed. It is really ideal for the particular medical considerations of this vaccine to have it in a clinical setting at the hospital sites or other sites that are set up well for the observation period that is required, which is at least 15 minutes for every individual. And for those who have had a history of anaphylaxis, we want to wait at least 30 minutes to monitor them. So the setup and the location it needs to just be done very thoughtfully.
So how about the timeline and which hospital systems are ready to do this? I know OHSU did a limited number of SEIU workers, about 2,000 this weekend, or was trying to get through them this weekend. Have you heard from anyone else that, yes, we're going to set up a clinic, and when that's going to be?
Yeah, all the hospitals actually have been standing up larger sites. Some of them have large employee populations that they've been able to move through. I think that what they were able to do 2 weeks ago really increased last week and is increasing even more this week. And I think that they have in the works some increases for capacity next week. So I think that they're ramping up really quickly to see a lot more people per hour per site. The other pathway I wanted to mention, and this is helpful, I think, for you all to understand that because all the healthcare entities are not ordering vaccine right now for their patients yet, and that vaccine, depending on the type, either came in a box of 100 or a box of 925. If you were a healthcare provider who had enrolled with the state to be eligible to receive vaccine to give it out, you could only give it out to your own employees if you had at least 100 employees who are eligible. And the state has been working as fast as they can to enroll and process all the paperwork of all the healthcare providers who are getting ready to be able to vaccinate their own patients. But a lot of them were too small entities to be able to receive the vaccine in the boxes that it has been produced in. They would have like many, many, many doses left over, and that wouldn't be the most optimum way to do the high volume. The 925 dose boxes, that's a lot for folks to get through and use quickly so they can receive more. And it also had, as you know, to be kept in ultra cold storage. Most sites don't have any of that ultra cold storage capacity. So the idea that the hospitals ended up being the hubs of receiving the first vaccine, instead of, for example, us going to use like a retail pharmacy pathway approach instead, was in part just influenced by the type of vaccine, the storage. It's very fragile if it's transported once it's thawed. So all of those kinds of like logistical considerations actually ended up driving us towards the model we have now. Some of the way that the hospitals have been increasing their ability to disseminate to other outpatient settings, for example, is that they have taken a lot of their vaccine allotment and then handed it over to the larger chain type of outpatient practice that did have the capacity of having enough of their own employees to give it out. So we are trying to utilize all the pathways that would work within the constraints of how this vaccine needs to be handled very carefully.
And a follow-up to that, have you offered the hospitals, or has there been conversations to the hospital systems about compensation for this? I mean, it's been a really tough past year financially for the hospitals. Who's paying for them to run these clinics? And also, what about liability considerations? Have you figured that all out? Because it's really not, it wasn't put on them originally to give out these vaccines.
Yeah, that's really at the level of state and federal reimbursement mechanisms, as well as state contracts, not at the level of each local health department. Especially, as you can imagine, in our region, that wouldn't function very well because our hospital systems are regional entities that cover multiple counties. So they really try not to enter into individual contractual relationships with each separate local public health department. We all try to work well as a region with them. And oftentimes those kinds of contracts happen at the state level. The hospitals can charge administration fee. Any of the folks who have vaccine right now and are providing it to others can charge an administration fee to the insurance coverage of the person being vaccinated. So there is a pathway or a mechanism right there, but those questions are probably better for you to bring to the Oregon Health Authority. That's sort of outside of the purview of local health departments.
Thank you.
I think we're getting down. If we can take maybe one or two more questions, we'll let these big brains go back to their desks. If you have one more question, anyone?
Kim, if you could ask OHA to change one thing that's been an obstacle for you to getting more priority people vaccinated, what would you like to see them do differently?
I hate to disappoint you, but I'm sure I will come up with so many learnings for all of us about how each of us could have done things drastically different at every step of the way. I am so working from 7 a.m. till midnight on the processes we have at hand and developing the collaborations. I think we're actually very rapidly moving through breaking down a lot of those barriers and obstacles we've had. We're doing a much better job than we were 3 weeks ago, even acting cohesively and collaboratively. So right now, I think I'm not quite ready yet to say what were the biggest lessons learned that we've had along the pathway. Certainly, we've all had a lot of lessons learned. I hope nationally that we've had lessons learned as well in terms of the importance of public health and the level of funding and resource that it takes to have a public health system be robust enough and ready enough to deal with this. Some of the challenge that we've all had between state and local is just decades of underfunding. So that would probably be first on my list, frankly. Yeah.
And I think we can continue to share that we're also doing this in the midst of being in a high-risk situation with hundreds of cases of COVID in each of our counties every day. So we're balancing it on the work of public health for case investigation and dealing with outbreaks and working with our school partners as they begin to consider opening schools for in-person learning. So there's a multitude of work going on in addition to vaccines.
Dr. President, any final words before we sign off?
No, I think that they both just captured everything I have to say. Thank you.
All right, thank you all. If there's something that you needed to follow up on, please email either myself, Kate Yeiser, Mary Sawyers, Kim from Clackamas County, Kim Dimworthy, excuse me, and we will try to answer your questions. But thanks everybody for being here, and I think we'll all be watching to see what happens next. Thanks so much. Bye-bye.